In this module, we will talk about frequently asked questions after hip replacement. Is it normal to have a fever after surgery? Yes, temperatures up to and even above 101 degrees are normal in the first few days after surgery. If they persist beyond several days, please contact our office. Is it normal to have nausea after surgery? Yes, nausea is a common side effect of anesthesia and surgery. It may also be a side effect of postoperative medications. We will give you a prescription for Zofran. If you have a history of significant nausea problems, let your care team know, and we can prescribe an additional scopolamine patch which can be placed prior to your surgery. Is it normal to have constipation after surgery? Yes, constipation is common with pain medications. We recommend starting a bowel regimen with Colace and Miralax even the day before surgery and continuing for the week after surgery until bowel habits have returned to normal. Additional laxatives may be needed, such as milk of magnesia or suppositories. Is it normal to have dizziness or lightheadedness? Yes, this is common due to anesthesia, fluid loss, and pain medications. Make sure to stay well hydrated with electrolyte fluid like Gatorade, Powerade, or Pedialyte, and be careful arising suddenly. Change position slowly. Sit before you stand. I have wound drainage. Is this a problem? There may be some bleeding through the dressing for the first 24 hours. This can be reinforced with a new dressing if the postoperative one is saturated. Persistent drainage can be a concern for infection and should be addressed. Notify your surgeon if you have persistent wound drainage. My hip is bruised and swollen after surgery. Is this normal? Swelling and bruising around the incision and down the leg are normal after surgery. You may have swelling all the way down to the ankle and foot. Elevation and ice will help reduce this. How long will my leg be swollen? Leg swelling may persist for 2 to 3 weeks after surgery, and as your mobility improves, should subside. How long should I keep a dressing on my new hip? We recommend keeping a dressing over the incision for 2 days, after which the incision can be left uncovered provided it is dry. The steri strips will stay on for a few weeks. When can I shower? You can shower on postoperative day 2. Try to keep the water from hitting your incision directly and put a fresh dressing over the incision for showering. When can I submerge my hip under water? We recommend patients wait at least 3 weeks for this, provided the wound is completely dry with no drainage. Is it normal to feel tired or depressed after surgery? Yes, the stress of surgery and recovery, as well as the energy devoted to healing, can lead to fatigue and depression for a few weeks after surgery. These are all normal occurrences that typically get better after 4 to 6 weeks. Is it normal to have sleep disturbance? Yes, disturbance in normal sleep patterns may be common for the first 6 weeks after surgery. Medications like Tylenol PM or Advil PM may be used at nighttime to help facilitate sleep. When can I drive? If your left hip was the operated side, we generally recommend waiting 10 to 14 days, and if your right hip was the operated side, we generally recommend waiting 2 to 3 weeks. If you are going on trips longer than 1 hour, we recommend you stop every hour to get out and walk, to keep the blood flowing and reduce the risk of blood clots. When can I fly? If you can wait 6 weeks to travel by air, that is safest. If you must fly before that, we recommend that you wear a compression sock, take aspirin, and get up and walk around every 30 to 45 minutes. When can I return to work? Return to work depends on what you do. If your job is sedentary, you may return as tolerated. If it requires more strenuous activity, this may depend on the speed of your recovery and the specifics of your job requirements. Talk to your care team about this. Will I set off the metal detector at the airport? Most security systems at airports are surface scanners and not metal detectors. Your hip will not set off a surface scanner, but it will set off a metal detector. If you alert security of your replacement, they will generally just do a light pat down. Are there any forbidden activities after hip replacement? Once fully healed, hip replacements are very durable and permit most activities. Repetitive high impact, such as distance running, may risk earlier wear and is generally discouraged. Shorter running, as in racket sports, is fine. Other activities such as skiing, hiking, biking, golfing is all permitted. How long does recovery take? Recovery time may be different for everyone depending on the severity of the arthritis, preoperative range of motion, and many other factors such as genetic healing response. In general, it takes 9 to 12 months to reach maximum recovery, but patients may be 75% of the way there in the first 3 months. How long do hip precautions last? We generally recommend avoiding positions of risk for about 8 weeks, after which time the soft tissues are usually healed enough that the risk of dislocation is low and patients may begin to forget about the hip precautions. We thank you for entrusting your care to our practice. We take great care to ensure the best possible outcomes for our patients. Our Avatar program has been refined over years of experience with 3 main goals: less pain, better function, faster recovery. For any specific questions, please reach out to us at avatar@kneehipshow.com.